Union nurses overwhelmingly voted today to authorize a strike after both sides have failed to reach a labor deal. Joe Ranieri joins us now live from OHSU with what this means for both nurses and patients. Joe.
Good afternoon, Brittany. This was a historic vote. Now, 95% of the nurses here at OHSU voted to approve authorization for a strike. Now, what does that mean? Well, it does not mean that a strike will definitely happen. It basically just allows the nurses and their unions to make contact with the OHSU to let them know that they will strike if a contract negotiation isn't reached over the next few weeks. I talked with a couple of nurses earlier today at a rally along the South Waterfront who tell me they want two things: better pay, and second, better working conditions. There is no denying how challenging things have been for frontline workers like nurses over the last couple of years.
We lost over 60% of our staff during the pandemic. We relied tremendously on travel nurses, and thank goodness for them, because they really saved patients from certain death.
Now, OHSU nurses are demanding a better contract. That's why an overwhelming majority of nurses, 95%, voted to authorize a strike.
We don't want to strike. We want to take care of our patients. We want to come to work, but we need a fair contract to do that.
Many of the more than 3,000 nurses with OHSU showed up to a rally Monday morning at Elizabeth Carruthers Park on the South Waterfront. That included oncology nurse Duncan Zvetsky.
If I have to spend my entire night just trying to keep people alive, I don't get to spend time with the patient in a meaningful way. I don't get to spend time and have that emotional connection.
What nurses want? Not only improved working conditions, but also a safer work environment for patients and staff.
I'm really proud to be an OHSU nurse. I love emergency medicine, and I want to continue to be a safety net for my community.
In a statement, OHSU said they take seriously a possibility of a strike and hope it can be avoided. They said they are offering a wage increase of 15% the first year of the deal, followed by another 5% the last 2 years of the contract. The hospital system also said it will meet or exceed state-mandated staffing levels by the middle of next year. While no agreement has been made yet,
we're hoping we don't have to do that. We are ready to bargain and ready to strike every day.
Nurses are hoping that a fair agreement can be met soon. Now, if you're a patient here at OHSU right now, it's business as normal. You can still show up and nurses are still on the job. Today's vote just means that the union can call now a strike, but it wouldn't happen right away. By law, the nurses would have to give 10-day notices before walking off the job today. And earlier today, OHSU did reach out to the union representatives with the nurses, saying they are hoping to go back to the table and talk about a possible agreement here very soon. Still no word yet on just how long contract negotiations are expected to take place. Reporting live in Southwest Portland, Joe Ranieri, KGW News.